self-care. All right, so over here, this is how our evening will be structured. We're going to start off with what is self-care and look at the 4 points, looking at the different types of self-care. Then we'll move on to some tips and recommendations, and then look at a little acronym that I like to call DOSE. And then there'll be an opportunity for questions, and then the closing thereafter. All right, so starting off with what is self-care? Self-care at face value is self-explanatory. It is the care of oneself. But what does it mean and how does one care for oneself? That is what we're going to be looking at today. In occupational therapy, I'm an occupational therapist by profession, so I look at it from my perspective or my profession's perspective. We use the WHO's definition. So that's the World Health Organization. And this definition is the one from 2014, and it reads as follows. The ability of individuals, families, and communities to promote, maintain health, prevent disease, and cope with illness. So in this definition, it encompasses a couple of things, and it looks at the individual, it looks at family, as well as community. When we break down the different elements there, we're looking at aspects such as hygiene, nutrition, lifestyle, environmental, and socio-economical factors. So when we're looking again at health, at self-care, it's not just only about ourselves as the individual, but it's also how we care for the people around us. We're at risk of increased stress, burnout, and compassion fatigue, as well as vicarious traumatization, when we don't look at take caring of ourselves and making sure that we're managing our own care, and then by extension others, instead of the other way around. Before we move on, Marley, is there anything you'd like to add?
No, nothing from my side, Lolly.
Not as yet. Okay.
Not as yet.
Wonderful. Right. So now we're going to focus a little bit on what happens when we don't take care of ourselves. So this is the outcomes of poor self-care. And then we'll go a little bit deeper into the individual components of self-care. So when we're not taking care of ourselves, or the outcomes of poor self-care can result in these 4 different factors. It usually starts off with stress and then moves on to burnout, then compassion fatigue, and then lastly, vicarious traumatization. So when we're looking at stress, here we're defining stress as a state of mental or emotional strain or tension as a result from adverse or demanding circumstances. So if we're looking at an example to better understand this definition, it can be noting your loved one's addiction. So this may be in the earlier stages when you're seeing, okay, there's something going on here. There's the erratic behaviors, there's the unpredictable behaviors, and as well as time, money, and resources that are set for yourself and your family that's now being directed to focusing on your addicted loved one. So that's kind of when you start noting the shift in focus on your well-being and the well-being of the collective. Remember, we're looking at individuals, families, and then community. Then from there, we move on to burnout. So when we're looking at burnout, traditionally used a lot within the workspace, but of recent times, people are noting burnout to happen outside of the workspace, and it's most evident in the addictive patterns. So now we're looking at a state of emotional, physical, and mental exhaustion that is caused by excessive and prolonged stress. So remember, starting off with stress, moving on to burnout. Using the above example that we had of your loved one in addiction, starting to note the changes, and then the resources starting to shift towards them and no longer looking at the collective as a family. So here This is when your stress is an autopilot response. That's the easiest way that I can explain it. When the stress becomes all consuming and it takes all the focus, all the energy, and the motivation that you have. I'm just going to take a sip of water. All right. From there, we move on to compassion fatigue. So, compassion fatigue can be defined as emotional and physical exhaustion leading to diminished ability to empathize or feel compassion for others. And this often describes as a negative cost of caring. So essentially, remember we started off with the stress where the focus is shifting. We're at the burnout stage when it's an autopilot response to focus on others or external factors. You're no longer looking at yourself. And then you reach a stage where the empathy is starting to diminish. And this is the beginning of dissociation, a sense of apathy towards yourself and others. You may be experiencing a lack of joy, a sense of hopelessness, and self blame. Because how did we get to this point where you have no reserve left for other people around you or even yourself? Um, this is a lot in the enabling patterns when you start to note your part in the situation, and that's where that self blame can also come in. And then, kind of, the end of this cycle or destructive patterns would be vicarious traumatization. So, a lovely big word, but in essence, it's just the end stage where we're looking at negative reaction to trauma exposure, and that can include a range of psychological symptoms. So, you're looking at this on a spectrum. Not everyone will have everything, and not everything will be applicable to everyone. Again, on this spectrum of responses and reactions, we're looking at a flight or fright, or sorry, fight or flight. We've got freezing, we've got fawning. So one may separate themselves from the current moment. So if we're starting off with the situation of our addicted loved one, we've noticed that the stress is starting, then we're moving on to burnout, then going on to the compassion fatigue. By the end, you begin to dissociate yourself from whatever is happening. That autopilot response is now across the board for everything in your life. It's no longer isolated or limited to the addiction and those patterns and cycles. Before we move on, Marley, do you have anything that you'd like to add at this point?
No, Lolly, I'm still good. He's still good.
Okay. So now we are going to be going into the 4 areas of self-care. Some of these may be interchangeable in terms of a bit of an overlap, but we're going to look at them one by one and see what can come up for us. So I'm going to start off with physical self-care because for me, it's the easiest of the lot to understand and to do. And if we're looking at the image over here, the image provided gives us a very simplistic view of the physical self-care. When in active addiction or having a family member inactive, the energy used may distract from yourself. So looking at your sleep may be affected where you are no longer sleeping or got restless sleep because you're obsessing or consumed by your loved ones' whereabouts, or are they okay? What are they doing? What have they taken? What could they possibly take? Looking at all of those factors. You may no longer be eating at all, or you may not be eating as healthily as you'd like to. You could start taking some shortcuts in the kitchen where, not let me just get some fast food because it's quicker and you need to be on your toes and there's no slowing down, there's no rest, there's no relaxation anymore around the eating. Because eating is not just about, am I eating my 3 meals a day and 2 snacks? It's also about the quality that you're eating. What does your nutrition look like? Are you consuming enough of the appropriate food groups? Are you eating more carbs than you are your vegetables, your vitamins, and your minerals? Are you not eating enough protein? All of those things can be affected in the self in the physical self care area. Then we're also looking at your quantity and your frequency of your eating. Are you eating very little, or are you eating more than you would normally? There may also be a decrease in your water increase, as well as a increase in your unhealthy fluids. For instance, your caffeines, your fizzy drinks, your sugary drinks, your energy drinks, etc., may start going on the up and up, but then you're not having your appropriate amount of water. An easy way to kind of look at how much water you should be taking per day on average, again, it may vary from day to day, is if you take how many kilograms you weigh and you have a cup being 250 mils of water for every 10 kilograms, that would be a nice way of just, quick calculations of how much water you should be having on average. And then when you're in this pattern of not looking after yourself, whether it's a direct result of your loved one being addiction or just kind of the chaos that comes with addiction, is that there may be less time for exercise, and there may not be an adequate amount for meal prep, like I've already mentioned, and medical care and health care can start to deteriorate as a poor result of your self-care. Again, this comes with whether if you're not sleeping, that may result in some brain fog, some headaches. If you're not eating well, that may affect your dental hygiene, as well as your gut health as well. So it's really looking at all aspects of your self care. It's not just, oh, am I bathing or not? It's also what are the smaller and more intricate parts. Okay, Madeleine, anything from your side?
Okay, so I completely agree with you with the physical self-care tips. Do you think physical self-care is very, very like the first step to self
If
when it
I
comes to
missed the
self-care?
yeah, I missed that last bit, but are you asking if I think,
Can you hear me?
yes, I can hear you. What exactly are you asking? Can you just say that again to me? Okay. Really, I can't hear you at all. I don't know if anyone else can hear what you're saying, but I'm assuming you're asking if I feel that physical self-care is the most important one, or it's the first one to go. I'm not too sure. But from my side, if
Yes.
that's what you are asking, I wouldn't say it's necessarily more or less important than the other three that we're going to go through. But I would say it's most likely the easiest one to spot, because if you're looking, if you meet with anyone, let's say you walk out your house, the first person you see, what do you see? You see the physical side of things. You don't necessarily see the spiritual, the emotional, or the mental well-being. So from that perspective, it may be the easiest to spot, but I wouldn't say it's necessarily the most important or the first to go. I don't know if that answers your question.
Okay, thank you, Lolly. I totally agree with that, of what you said.
Now, moving on to emotional self care. So, when we're looking at emotional self care, it's essentially just taking care of your emotions and feelings. So, this will in turn help us to be able to process what we are feeling and address it in a healthy way. And this can help avoid possible disasters and crises. So, when we're looking, at the stress to vicarious traumatization, emotions are quite important in that aspect. You know, if there are a broad spectrum of emotions. Emotions can be positive or negative. We feel what we feel when we feel it. There's no running away from that. You can't run away from happy emotions or sad emotions. We all feel hurt at some point, anger, joy, love, sadness. They're all a part of our everyday life. The aim is not to deny or suppress them, but it is to address and process them. So, I mean, right now, if you have a family member that is currently inactive or in treatment, whatever emotions you are feeling around that situation are valid because that is your experience. It is not fair to you to deny yourself feeling that emotion, and it is not fair for your loved one to deny or invalidate that emotion that you are feeling because it is yours alone. There may be things that make you happy, but that make me sad, but it doesn't make the experience less valid or less important. It's just, okay, if I am angry, how am I dealing with my anger in a healthy way? If I'm not able to figure it out on my own, then let me reach out for help. Let me get additional support to be able to process my emotions. You could be in a spiral where you no longer know or understand what emotions you're feeling because everything is happening all at once and there's no time for you to feel that emotion or process that emotion. So this is why it's important first and foremost to identify what is that emotion that you are feeling and what you want to do with it thereafter. I don't know if there's anything you want to add here on the emotional side of things before we move on, Marley.
I think it's important to realize that emotions you can't control. So, like you said, emotions come and they go. You can't choose to feel a certain way. But it is important to realize how you respond to that emotions, or like you said, how you treat that emotion that is going to be your responsibility at the end of the day. I think when it comes to self-care and emotions, I think it's important for everyone to check in with themselves during the day, not only when they realize they're mad or when they realize they're stressed out. I think it's important to constantly check in with yourself, let's say morning, lunch, afternoon, as many times as you would want, so that you as a person can also become aware of the emotions you're actually feeling. Because uh, I don't think there's a way of you sorting out that emotion if you don't actually know what you're feeling. So that is just what I would like to add, Lolly.
Definitely. And I in mirroring what you're saying, you know, when we look at addiction's a family disease. Yes, your addictive loved one may be the one in treatment, but you as family and loved ones have also undergone your own kind of addiction, you know, where there isn't necessarily time for you to check in with your emotions, or there's your loved one situation is all consuming that your emotions kind of get skipped over. I mean, it's a normal compulsion for when you see someone, whether it's at the office or at the shop or even here, when we ask, "Oh, how are you doing?" It's like, "Oh, I'm fine," or "Oh, I'm good," or "I'm great," but not actually identifying what is the emotion that I'm feeling. So when I'm saying fine, am I saying that I'm content? Am I saying that I'm calm? Is it just to move the conversation along? Am I afraid? Am I stressed? But I don't quite know how to voice it. So it's important that, okay, fine, in everyday life, cool, we just say those kinds of things. But checking in with yourself, as Madeleine and so wonderfully put, checking with yourself, what am I feeling right now? Where is this emotion from? I'm feeling a little bit frustrated. Okay. Is the frustration related to what is happening right now? Or maybe I woke up, I didn't have a restful sleep. So my mind's a little bit distracted and I'm maybe falling a little bit behind in whatever work that I'm doing. So that is now making me feel frustrated. What do I do with that frustration? Let me maybe go take a tea break, go have some tea, and maybe call someone that I know will make me laugh, and that might help alleviate a bit of that frustration so that I can get back to what I was doing. Those kinds of things. All of this takes practice. I'm not saying you're gonna sleep, wake up, and know exactly how to do this. So this is just kind of some ways to check in with yourself to identify what you're feeling, when you're feeling, and kind of what to do with it. Cool. Now we are moving on to mental self-care. So mental self-care, if you can look at it as kind of gaining a peace of mind type of self-care. When we have peace of mind, we're able to unlock the potential of our mental health through positive thinking. Again, not to say that negative thinking won't come. Dark thoughts do come. Doom does seem like it's all around us, and gloom are not the only things happening, but they are. It may sometimes feel that they are. Um, but it's a matter of taking some time to relax and sit with positivity and positive thoughts of yourself and what's around you. And this will help you grow and align a sense of balance within your mental state. If you or your loved one or your loved ones struggle with mental illness, it is important that you are using the tools that have been recommended, whether it's medication or therapy or support groups or other types of coping skills. It's important to remember when it comes to mental illness in the mental health part of things is certain psychiatric conditions come with medications, that those medications are a way of bringing your chemical balances to naught. It is your responsibility thereafter to utilize the various tools to keep yourself in a positive space or in peace of mind. Not to say that you may not have depressive episodes or some anxiety or anything like that. That again is just what comes with life. But if it's specific to the mental illness part of things, the medication is just to help get you to naught so that you're at the same level as others. It doesn't cure the mental self-care type component. You still need to work at it. And the onus is on you to, seek help if you need to seek help. If you struggle with um, negative thoughts, it's about challenging those negative thoughts, discerning between fact and fiction or feeling and fact. Those are very important things to remember when it comes to mental self-care. Um, Sometimes I get mental self-care and emotional self-care confused. There is a little bit of overlap, but remember again, when it's the emotional self-care, it's about the emotions, the feelings, the happy, sad, glad, mad, what are we doing with those emotions? And then the mental self-care is about that peace of mind. How do I keep my mind active and comfortable and relaxed and able? Is there anything you'd like to add on the mental self-care before we move on, Madeleine?
Nothing from my side. Thank you, Lottie.
Lovely. Thank you very much. And then the last of the four self-cares is spiritual self-care. As humans, we have a need for a sense of belonging. Uh, if you just look at the different types of groups around, there's different religious groups, there's creating your family, there's the different fellowships, there's your friends, there's maybe a place that you can go to where you feel you're a part of. When we're looking at this sense of belonging, we're looking at it from a point of spirituality. It's not just religion. Religion does provide a sense of structure, well, a structured medium for practicing spirituality, but it's not to say that it's the only way to practice your spiritual self-care. Again, we are looking at a sense of peace, a sense of belonging that requires you to look outside of yourself. Um, if we look at step 2 and 3, where step 2 is came to believe that a power greater than ourselves could restore us to sanity, and that already is looking for something outside of yourself. It's not just within yourself, if that makes sense. Now I can't remember what step 3 is. But again, it's also around a higher power and reaching for a sense of belonging. Um, and and not all of this will be applicable to everyone. You know, when we're looking at spirituality, maybe you are someone that enjoys meditation, but the next person may enjoy a more artistic way of self-expression or connectivity. Maybe another person likes to walk in nature, and then another person prefers to actually have brunch with friends inside the house. And then for clarity, these are just suggestions. These are just, not everything again will apply to everyone. Take what works for you and leave the rest. But if you are looking at the different parts of self, that is what is important when we're looking at the different when we're looking at self-care. Sorry. Before we move on to the next, Mandalay, anything from you on spirituality or spiritual self-care?
Nothing.
Okay. Right. Now we've got some tips and recommendations. So I'm going to go through each tip and provide a little bit of clarity on each one. Right. So taking some time to do things you enjoy, whether it's something that you do weekly or monthly or daily, that is up to you. The onus is on you to establish what is it that falls within that space. But as long as you are taking that time, if you need to, formulate a weekly schedule for yourself or a monthly schedule for yourself, or at the beginning of the year, you take out your diary, you look at your budget and what you have available, what resources you have available for yourself, and then structure it that way, where you do something like that. I mean, here, if I can just give an example from myself, is I have a sort of like a weekly-ish type of planner where I'll just put one activity a weekend that I know I'm going to do something that's a little bit more fun for me. And then we've got taking care of yourself. So when we're talking about taking care of yourself, yes, we're looking at self-care, but it's a matter of making sure that you're not just taking care of others. It's very easy to fall into the position of carer or rescuer when there is the chaos of active addiction happening around you, where you're looking after other people, whether it's the addicted loved one or others, but not taking the time for yourself. A little bit on looking at the first point. The second point is about, am I drinking enough today? Am I getting enough rest? Am I checking in with my emotions? Am I taking my medication as I'm supposed to be taking it? Am I calling the people that I know will charge me, or charges and provide that energy, not charge financially? But just making sure that you are taking care of those primary needs. Then next is prioritizing yourself. So self-care is a little bit selfish, but how it ends up being selfless is if you are able to take care of yourself and make sure your cup is full, then you will be able to assist those around you. So ensure that you are prioritizing your needs um, in whatever you need to do on a daily, weekly, monthly, annual basis. Not to say that you don't need to, you know, prioritize whatever is required within the home, whether it's your finance, when you're looking at it from a financial perspective. Not to say don't pay your children's fees or things like that, but it's just to make sure that you are getting that, you're prioritizing that little pocket for yourself to make sure that you are able to take care of yourself and set aside time for things that you enjoy. So we kind of double back to the other points as we move through. Then set specific self-care goals. I got this wonderful Secret Santa gift last year for this year. It is a wellness diary. And each month I can set myself some goals. Each day I can write what I'm grateful for and what my goals are for the next day. And that is a nice way of, also setting aside or creating specific goals for yourself. I've also recently started, taking a bath once a month. I'm not someone that enjoys bathing, but it's just a way for me to decompress and take things a little bit slowly. So I look at more as a relaxation tool instead of a hygiene tool. So it can be simple things like that. Just say to yourself, okay, what is it that I'm going to set aside for myself this month, this week, this year? Then next, we've got making self-care a habit. Yeah, that one I feel like it's quite self-explanatory there, but not just to do it once. It's important that it's something that you do continuously so that it becomes a lifestyle. Unlike, like a fad diet. If you do a fad diet, you may lose weight or get to your goal weight for that short period of time. But what happens thereafter? You go back to your old ways, and you either gain the weight that you lost, or you gain more, or you are not happy with yourself. That is why it's important to make things habitual. Okay. Then setting boundaries. Setting boundaries is something that we speak often about it within the changes team, because of how important it is. Boundaries is not just about, how do I protect myself from whatever ills there are around me, but it's a matter of how do I show myself that I am important. When you are setting boundaries, it is not to be cruel to the other person. It's about respecting yourself. It's about prioritizing yourself. It's about making things a habit for yourself, taking care of yourself, and taking the time for yourself. And these boundaries don't necessarily have to be around the self-care components that we looked at. It can even be about respecting your space, respecting your time, respecting your material goods, respecting um, your mental space as well. So it does encompass a lot of things. And when we're looking at boundaries, the first thing you need to establish is what is important to you, what is your bottom line. Once you've gone there, then it'll be easier to set those boundaries. And it is always important to follow through with whatever boundaries you have set. If you falter back on those boundaries, it will be very difficult to maintain proper, healthy self-care, because then you are going to return back to the old patterns and old cycles. Next, we have a few minutes of self-care is better than no self-care. Even if you set aside a goal, like in the previous, one of the previous points there, if you say, okay, I'm going to take a bath for an hour, lie in the bath for an hour. But then on the day that you've scheduled that, you actually don't have an hour anymore. You only have 20 minutes. Take that 20 minutes and use that 20 minutes to the best of your ability. And that's what it is. It's about that consistency in showing up for yourself, in making things a habit rather than just skipping out of it. Then that way you skip out this time, you skip out next time, you skip out another time. So it's just easy to get back into that old cycle. Right, then we have unhealthy activities don't count as self-care. When we're looking at these healthy versus unhealthy, looking at things that are very rigid, that can fall under an unhealthy kind of movement where it's very strict, rigid rules. So we want something a bit more flexible that'll allow for you the freedom to have that peace of mind and lessen that anxiety. Looking at things that you want to do instead of have to do, those are that can kind of create a distinction between whether it's an unhealthy type of self-care or a healthy type of self-care. Something that is joyful is obviously a lot healthier than something that is unenjoyable. Where you're doing things at a moderate pace instead of excessive. And if we're looking at something that's more enriching to your sense of belonging, your peace of mind, your physical being, your emotions, instead of something that is isolating. Another example of a healthy type of activity is listening to your body, listening to what is it that your body needs in that moment, at that time, and working towards that. And lastly is to keep up with self-care even when you're not feeling good, because that'll release those endorphins and those happy hormones and make you feel better about whatever's happening. Nadle, anything from your side before we move on to the next slide?
I would like to add when it comes to making self-care a habit. So making something a habit takes around 21 days to actually form that habit. So don't be discouraged if you start with a habit when it comes to self-care, like I'm going for a walk every day for 10 minutes where I'm just by myself, where I can just sit with my thoughts. And the next day you forget about it. I don't want you to crucify yourself by forgetting about it, because it takes time to build this habit. I would recommend that in a case like that is maybe when you start with what is your self-care routine, how does it look, is to maybe write these things down. Today I'm going to focus on these things, so you don't forget about it, so that the negative thought that comes with forgetting it doesn't happen. But also realizing that it takes time to form that habit. And then lastly, I would like to add what you said about keep up with self-care even when you're not feeling good. Um, so firstly, it's important when you're not feeling good to actually do it. But we tend to forget to focus on self-care when we're in a good headspace. Because what happens then, we break that habit of self-care because we're feeling good, we're in a good space, we don't think about what we need at that point, and then we break that habit again.
Yeah, 1000%. I did see the comment. We're left with one more slide and then we'll move on to questions. All right, so this is DOSE, as I had previously mentioned. So DOSE, the acronym stands for dopamine, oxytocin, serotonin, and endorphin. This is just a different way of seeing the different self-care needs through the various happiness chemicals, DOSE, as you can see there. The various activities may also result in the release of more than one of the chemicals, much like the different areas of self-care in terms of physical, emotional, mental, and spiritual well-being. There may be activities that overlap that can be both taking care of the physical well-being as well as the spiritual and emotional well-being. So it's try not to look at things in isolation. There may be overlap, more often than you may realize. So yeah, this is just another way of how to hack your happiness chemicals. So we've got dopamine, which is the reward chemical. We've got oxytocin, which is the love hormone. We've got endorphin, which is the painkiller. Serotonin, which is the mood stabilizer. So how I had worked it out in my head is that dopamine is kind of like physical self-care, and oxytocin is more of a spiritual self-care. Then serotonin, I looked at that one as the mental self-care. And endorphin, I looked at that one as the emotional self-care. But again, there's overlap across the board. None of this is set in blood, but it's just another way of looking at things for yourselves. Here, just a couple of resources. These are the resources I used for this presentation tonight. Yeah, got any questions about them, more than welcome to ask. And then we are now open for questions. I saw there was one in the comments.
Yes, the question was from Trevor. What happens if one wants to quit smoking? Must you go on medication, or is it willpower?
Oh, I do not like to touch the ones about smokers. I'm scared of smokers. I think it depends on the severity of the smoking. But I mean, I'm not a pharmacologist, so I don't really talk much about medications from my side, except for obviously when I know which medications you're supposed to take or what. Um, but in terms of something like smoking, you really need to look at more of a goal setting type of thing. So instead of, is it something that you can do cold turkey? Is it something where you need to taper yourself off? It varies from person to person. Some people in my life I know have lessened how much they smoke, but haven't completely stopped. Some people stop cold turkey. So I know I'm not giving you the answer there that you want, but that's all I can say much on the smoking. I don't know, Marile, if you have anything that you can say on the smoking.
So I definitely agree with you with setting goals. So what we teach a lot of people is using the word SMART. So SMART goals. So SMART goals is when you set a goal, it needs to be specific. So let's take smoking. My goal is to stop smoking cigarettes. Okay, it should be measurable, it should be achievable, relevant, and time based. Okay, so if you say you want to stop smoking in the next week, totally stop with it. Okay, there is people that can do it, but there's also people that it's sometimes unrealistic to set that goal. So maybe start by saying I smoke 20 cigarettes a day. So the goal is for this week, I cut it down to 15 or to 18, rather than just setting this goal, you don't get it achieved, and then you feel discouraged.
I don't know if that helps at all, Trevor. Any other questions? We've still got quite a bit of time. Please, if you would like to go, you can just raise your hand or type out something in the chat and then read it out. Yeah, so I guess short answer, willpower. That's how you see it. Yeah, but more goal setting. Any other questions? Or even just comments on your experience or something that you may be struggling with at the moment. I see here. Why is it when I would love to do something for myself, my spouse thinks it's being selfish? I'm always let down. That one is a tricky one. Um, I think it's a matter of your stuff versus their stuff. Um, if we look at the moderation, I think one of the things that I spoke about was just doing things in moderation. For them, from where they're sitting, it could feel that it is selfish because time is being taken away from them. And that is a process that they would need to work through, because it's not about you taking time for yourself, it's about how they feel in you taking time for yourself. um I don't know, Marley, if you have anything to add on there, but it's
No,
not
no,
about you.
I definitely agree with you on that. This is not about you. It is stuff that's coming up for them. I think when it comes to something like that, once again, you are not responsible for other people's feelings. You can only take responsibility for your own actions, okay? And your own emotions and how you handle it. With regards to that, I think knowing it's not on you, it's on them, and then setting boundaries. That is, I think, where boundaries and self-care is so extremely important. They need to work together, because when we take the situation, in order for you to be the best spouse for your partner, what do you need? You maybe need to go for a day out, maybe you do a spa day. That is your way of self-care. And by having that conversation with them and setting your boundary with them is something that they might understand. So I think this goes hand in hand with boundaries.
Mm, mm. And as you were speaking there, it just reminded me of communication. So I think, especially when it's, husband, wife, girlfriend, boyfriend, whatever the situation may be, there, it's a matter of communicating your needs. From where they're sitting, it's being selfish. From where you're sitting, you're taking care of yourself. So how do we find some middle ground? I think it's an opportunity to have an open and frank conversation about what is the fact in the situation and what is the feeling in the situation. What is it that you need and what is it that they need? And then come to some sort of middle ground. It could be completely that they are being the selfish person in the situation, or it could be that you are being the selfish person in the situation.
Mm-hmm.
But it's not about he said, she said, pointing fingers. It's about, okay, both of us are coming at the situation from different sides. Let's try to find some middle ground so that we can both better understand each other. So you can see, oh, it's not actually that they think you're being selfish. It's just that maybe they would like to spend more time with you. And
Mm-hmm.
that is the time that you haven't availed yourself to them. So how can we both accommodate each other? I don't know if that helps, but that's kind of how I would see it in that instance. And then we've got another comment from Trevor. In a situation of a court order, does it need to be for a year or could it be terminated at some time? So the court order, Kate, I know you're on. I don't know if you're able to answer that one. But my understanding is that the courts decide how long the court order is. But I don't want to give
I think
you the wrong information.
a court order can be terminated by a family, but it is a process. You'll go in and have to apply to have it terminated. As in with the application, you had to present evidence as to why you needed a court order. By the same token, you'll need to present evidence as to why you need to terminate the court order. in terms of a court order, the best advice is to work with whatever rehab they are in and ensure that because they're not going to work against you. It depends what you're trying to achieve. Now suddenly removing the court order doesn't necessarily have the best outcome. So, a court order isn't an intention to keep you under lock and key for the entire time. So you need to understand what the objective is. Why would you need to suspend a court order? It is a tool to help whoever's in the treatment facility have some consequence to their using if they chose to do it again. That's all it's basically there for, and that's its main purpose.
When we look at addiction, right? Over and above it being a family disease, is that how do we identify that someone is addicted? You may never see a person take the substance, but you notice from their behaviors. That's probably the first place where you notice the maybe increase in aggression, chaos, erratic behavior. That is what you are seeing. And that can lead down the road to the diagnosis of whether or not someone is an addict. With codependency, what are you seeing? Where do you start and where does your loved one start? And once you get that overlap, you're almost unable to distinguish yourself from the other person, which means that there is a lack of self. There's a lack of individuality. There's a lack of prioritizing yourself because you are enmeshed in that dynamic. So yes, I agree. I would say that it's closely linked to codependency. Okay. We've got another comment from Trevor. That's why court orders don't keep patient here, or if one come out to hold against victim.
Education.
Yeah. If you do have more questions on the court order stuff, maybe you can give us a call tomorrow to provide some clarity. I'm not the right person to ask about court orders.
Yeah, we're open
My apologies.
You can always email us or phone us if you want more information. We're very open to sharing information or setting up some time to discuss it. So please feel free to do that.